Welcome to Hair Talks by Terra Medical. I'm Dr. JC, and in today's episode, we're exploring low-level laser therapy and its role in promoting hair growth. So what is low-level laser therapy? Low-level laser therapy, also known as LLLT, uses low-intensity lasers or light-emitting diodes, LEDs, to treat hair loss. This therapy emits light at specific wavelengths that penetrate the scalp, leading to improved cellular metabolism and increased production of adenosine triphosphate, ATP, which is essential for cell energy. Additionally, LLLT modulates what we call reactive oxygen species, which may trigger the differentiation of stem cells and induces growth factors and cell proliferation in different areas such as the outer root sheath, keratinocytes, and dermopapilar cells. So let's explore the scientific evidence for low-level laser light therapy. Numerous studies support the use of LLLT for hair loss. One significant study by Dr. Leavitt in 2009 involved 110 male participants who were randomly assigned to use either the HairMax laser comb or sham device over 26 weeks. The results were impressive, with 86.1% of participants using the laser comb experiencing significant hair regrowth, an increase of more than 5 hairs per square centimeter. These studies employed advanced techniques like macroimaging and AI to accurately count terminal hairs, and the treatment was well tolerated, with no serious adverse events reported. Another study by Dr. Jimenez also included 146 males and 188 females. This randomized double-blind trial compared different models of laser comb, 7, 9, 12 beams, with a sham device over 16 and 26 weeks. All groups using the laser comb showed improved hair density, significantly outspacing the sham group. This study further supports the efficacy of LLLT in promoting hair growth, regardless of the device model. Lastly, a research by Dr. Esmat focused on 45 female patients with female pattern hair loss. This study compared 3 different groups of patients, one using topical minoxidil 5%, another using the Regrow LLLT helmet, and a third group combining both treatments. After 4 months, all groups showed a significant increase in the regrowing hair follicles. The combination group in particular reported the highest level of patient satisfaction and improvement, highlighting LLLT's comparable efficacy to minoxidil. In conclusion, studies have demonstrated that LLLT is safe and showed some efficacy in treating androgenetic alopecia. More than half the studies reported improvement in hair regrowth, including increased hair counts, density, tensile strength, and prevention of hair loss. While early trials were small and lacked controls, more recent trials have been larger and better designed, improving their validity. All studies indicated that repeated LLLT treatments improved AGA over time. In the largest randomized control trial, Dr. Jimenez demonstrated statistically significant hair regrowth by terminal hair counts in all patients. So, how long does LLLT therapy take to work? Patients often begin to see initial improvements within 3 to 6 months of starting LLLT, and this is backed by studies. However, results can vary based on individual factors such as the extent of hair loss and the adherence to the treatment protocol. Each LLLT session typically lasts between 15 to 30 minutes, with most treatment plans recommending 2 to 3 sessions per week to achieve the best results. Consistent treatments are necessary to maintain results, which may be challenging for some patients. However, if you are incorporating LLLT into a daily routine, like pairing it with a morning coffee, can help overcome this issue. In summary, low-level laser therapy is a non-invasive, safe, and potentially effective treatment option for patients with AGA. It works by stimulating hair follicles and improving scalp health With scientific backing and positive patient outcomes, it's a viable adjunctive treatment for those who's looking to enhance their hair growth. And thank you for joining us for this episode of Hair Talks by Terra Medical. Stay tuned for more insights into hair restoration and hair care. Until next time, bye!